Well, welcome back to the Christian Capitalist Podcast. We're so glad to be joined today by Valerie Barkov, my friend of many years, who has worked with me in the healthcare industry and representing hospitals and health systems in the way that they handle their financial affairs. And so today we're going to be talking with Valerie about what it means to her to be a Christian capitalist and the various work she's done on behalf of hospitals around the nation. Good morning, Valerie.
Good morning. Thanks for having me.
You're welcome, and it's so good to see you. Thank you for joining us today. So to get everybody started, let's talk a little bit about your background and what you do now at Wyndham Brandon and Shore.
Okay, sounds good. So 30 plus years of healthcare experience. I tell everybody that I'm one of those odd ducks that knew I wanted to work in the business side of healthcare the minute I stepped foot at the University of Kentucky. Luckily for me, UK had a bachelor's of health sciences in healthcare administration. So I went into that program and then I went on for my MBA. I have always focused in this business side, particularly the area of revenue cycle, which impacts the patient's financial experience. I have a lot of passion for the work we do, in that the world we live in is extraordinarily complex. Most patients do not understand the contract they have with their managed care company. A lot of hospitals struggle with this themselves. And so I've been a very mission-driven person in wanting to make sure that we made this the best experience that we could, collecting the money that was due to us, but also just making that experience for patients a little bit easier to digest. So first 8 years of my career, I spent in the Big Six, most of that with Deloitte. Had every intention of staying with Deloitte, but 9/11 happens.
Oh, wow.
I had a newborn and a 2-year-old and said, you know what? I think I'm going to stop this traveling thing, and thought I was going to take a backward step with my career, honestly, but it was a time when people who knew the revenue cycle were hard to get. So I got a job as the executive director of contracting and revenue management at DeKalb Regional Healthcare System, now part of Emory. Then I went on to be the VP of revenue cycle at St. Joseph's Hospital of Atlanta when we were part of Catholic Health East. Got back into consulting around 2009. Been with my company for 11 years and really excited about what we're doing now. Shore Health, I'm CEO of our technology company, Shore Health, and we work only with hospitals and health systems, helping in two main areas to help them automate processes to become more effective and efficient, making sure that we're using people at their highest pay grade. And then we also offer some cyber resiliency services for hospitals. Unfortunately, hospitals and health systems are just under attack at a rate of 2 times per week. And we've developed a tool that can help them keep their revenue cycle functioning while they're in the middle of the the cyber attack, so that they're not really stressed out about their financial fallout, that they can just focus on patient care.
Because there was a big, we're recording this in the second week of February of 2025. There was a big cyber attack this time last year involving Change Healthcare that really changed the industry. Can you tell everybody a little bit about that? Because we have an audience that spans generations and all different industries, students and retirees. Give us a little bit about what it means to be a hospital under a cyber attack.
Yeah, so the cyber attack that you're referencing is the Change Healthcare incident. I believe the statistic is 90% of hospitals were in some shape or fashion impacted by that particular cyber attack. Wow. And one of the things that I tell everybody is hospitals and health systems are considered critical infrastructure. Nobody is going to say that cyber warfare exists because of insurance policies. I think we've had that conversation. Sure. They're not going to say it, but there's a lot of us who believe that the Change Healthcare cyber incident was in retaliation for the United States involvement in overseas affairs, because you've got Russia, you've got China, you've got North Korea. They are the bad actors. And they are able to take out critical infrastructure, being the healthcare system. And so 90% of hospitals were impacted by it. It's been a year and some are still reeling financially from it, because we are very dependent upon electronic means of communication. And when we shut down the ability to send claims to payers, which stopped the cash flowing in. So it was a very big deal to a lot of folks. It also impacted pharmacy. It also impacted other areas of healthcare. So it was a pretty catastrophic attack. And the willingness for Change to pay that ransom made us a little bit more vulnerable as hospitals and health systems to future cyber attacks.
Mm-hmm. And so now you're working on a very high-tech, maybe not solution, but way for hospitals to recover from a cyber attack in the future.
Yeah, it's a fail-safe system that when you walk in and you get that unfortunate news that your systems are down, and the American Hospital Association has told hospitals you've got to be prepared to run on paper for 30 days. Wow. Average downtime is 4 to 6 weeks. We can deploy our product within 2 hours to get the engine back up and running. It doesn't give you full functionality of your EHR, but at least alleviates some of that pressure. So again, you can focus on what you need to do, which is take care of the patients, knowing that when your systems are back up and running, we've at least protected to as much as we can your financial position in the facility.
So when we talk about the Christian capitalist, as you know, the theme is hard work and generous giving to the poor and needy in the name of Jesus. There are lots of issues that you've raised, even in the first few minutes of your introduction, about how that works in this world.
Right.
And as you're talking about cybersecurity on behalf of hospitals and referring to we on behalf of hospitals, that really kind of to me, points us in the direction of talking about how hospitals serve the poor and needy,
right?
Which is in the previous conversations we've had, critical to revenue cycle. So we can get everybody on the same page. What does it mean to work on behalf of a hospital or for a hospital and be involved in revenue cycle?
Yeah. So I explained to everybody that healthcare is this very unique beast. We have your traditional financial processes, your accounting, your supply chain, all of that. But what we have that is so unique is the revenue cycle. And I think other industries might use the word revenue cycle, but it is in no way the same as what we do. It is everything that impacts that patient's experience, from the minute you schedule an appointment to coming into the facility, the nurses who help coordinate your care to make sure you're getting to the next level, the underlying infrastructure to make sure that the charges are correct, to the coders who are coding and translating the medical word into digits and numbers, to all the hardworking people in the business office who then translate that claim and send it out so that we can get paid at the end of the day. It's a very complicated process. It is, unfortunately, sometimes very stressful for the patients when it doesn't go well. And that's really, I think, the people that I tend to gravitate to always remember that claim at the end of the day has a person's name attached to it.
Well said.
And if we don't try to do everything we can to make that experience better, then we're just part of the problem. And so when you're running the revenue cycle, you need to make sure it's a patient-centric one and not necessarily, we've set it up to be department-centric and not patient-centric. And I think when you change your mentality, you're going to have a whole lot more success. And oftentimes the patient's financial journey is longer than their clinical journey. And that's why it's so important that we understand that it is a patient at the end of the day and not just an account number.
Well, it's interesting you say that, because Congress tried to respond to this notion of how the financial experience goes with patients by passing the No Surprises Act a few years ago. Is it still the case? I remember reading this a few times over the last 10 or 15 years that the majority of Americans who declare bankruptcy do so because of medical debt. Is that still the case?
It is. And I know they're still trying to help families out there when that comes to it. I think we were talking before the podcast started. For the majority of Americans out there, an unexpected bill of $200 can be catastrophic for them, making them decide between buying groceries or paying their medical bill, or keeping their lights on or paying their medical bill. And so sometimes it's easy to forget that $200 doesn't seem like a lot of money, but for patients, for the majority of Americans, $200 is a big deal. And we need to make sure that we are there to help them figure out how to pay us, right? I'm not saying don't pay us what you owe us, but let's come up with those approaches that make it easier to work with us and that are a little bit more compassionate when we're trying to work with the patients.
So speaking of compassionate, it's kind of difficult to see on our screen here, but Valerie's wearing a beautiful purple sweater here on this winter day in Atlanta and has a cross on her necklace. So how does compassion work into the process of dealing with patients in hospitals who are there, in many cases poor, certainly in need of medical attention, but you've got this cross on your neck that you're a follower of Jesus,
Hmm.
as just like most of our audience, just like me. How did compassion work into this process?
For me, it started when I was in college because I actually worked my way through college as an emergency room registrar.
Oh, wow.
And I wanted to get experience. And so that was the only job I could get was in the emergency room, was scared to death. But I watched people come in, and when we would have to ask for their copay, and they would give me crinkled dollar bills and give me their coins out of their purse, it broke my heart knowing that I was having to take that money and that might be the last few dollars that
Yeah.
they had. And so I think that experience of watching people come in for something that is already stressful and unimaginable. Nobody ever wants to be a patient in a hospital. Maybe there's a few who want to do plastic surgery
Right, right.
electively, whatever. But the majority of people don't want to be a patient. And then to watch them doing their best to try to give me something towards their medical bill really just sat with me. And I tell everybody, I think that experience, those 2 years that I spent as a registrar, really set the foundation for the way I view the work we do. Because I think if you haven't sat there and watched patients come in, you could be numb to it, right? You could forget that they really are just, coming in and trying their best, giving you the coins out of their purse to give you the $20 copay. And you almost felt terrible taking it. But that was part of our job, was to take it. So I think the compassion for me started by just recognizing that at an early age. So I'm glad I had that experience. And I'm glad I still, after 30 some years, reflect on it and reset myself whenever you start to get stressed. You reset yourself that there's a patient out there. I was on a panel last year, and they were bringing people who had, different experiences about why they were working in healthcare. And I was asked, my philosophy on the revenue cycle. And I said, it's just as broken as the day I got here. I had this idea that I could help fundamentally change the way we do business. And unfortunately, retirement is not too far down the line. And that I don't feel like I've made a difference. But he looked at me and he said, do you think you made the difference in at least one person's life or one family's life because of the work you did? I say, oh, yeah, I most certainly kept one patient from having a bad financial experience, particularly my days at St. Joseph's. He goes, then you did make a difference. And I really appreciated him
That's a great answer.
reminding me that just because I didn't fundamentally change
Right.
the way we do business, that somebody out there who never met me, who didn't even know, that they could have had a bad financial experience, benefited from all the stuff I was doing behind the scenes at St. Joseph's. And I appreciated him kind of reminding me
I
that
love
that
that.
that was, that I did make a difference out there. I just don't know.
Let's talk about your experience at St. Joseph's. You mentioned in our introduction that you were the vice president of revenue cycle
Right.
management and contracting. What's that like, working in a Catholic hospital where the mission of the hospital is different? A, because the hospital's nonprofit and
Right.
charitable, and B, because it's funded by, founded on the principles of Jesus, and in many ways goes back to Jesus' healing and his ministry, and to, of course, the story of the Good Samaritan.
Right.
So, how did it work at a Catholic hospital?
It is my most favorite job I've ever had. When you would walk into St. Joseph's, you could feel the mission. And I don't know how to describe it besides that, there were, statues of Mary. The nuns were very much involved. They actually lived on campus, the Sisters of Mercy. I think there was 8 of them. Their convent was right on our property. And we had to open every single meeting with either a prayer or reflection. They said, if you're not a praying person, we're not going to make you pray, but we would like you to give a reflection. And I think that in and of itself makes people remember why we're here, and just makes you not see it as a business, but let's reflect on what we were asked to do. So I think them being present, it is very different walking into a mission-driven health system versus a community hospital, academic medical center, or a for-profit. It's just, you can feel it when you walk in.
What do you think? What do you think causes that sensation? I mean, you're as we talked about, you're a Christian. I'm a Christian. I could agree with you completely. we mentioned this a couple of weeks ago. We used to frequently do work with, and I would visit St. Mary's Hospital in Athens,
Right.
Or Good Samaritan Hospital over there in the nearby area of Greene County. What do you think causes that difference?
The people. I mean, it really, at the end of the day, is the people. I give credit to the sisters who would remind us of why we were there. There was many a times I had stressful days. We were under an OIG investigation, and it's like Sister Jane knew. And the next thing you know, I see a knock on my door, and she's like, "I've heard you've had a very bad day." And I said, "Yes, I have, Sister Jane."
Oh,
And she's like, "I just want to let you know it's really hard to be a change agent, and we are here to support you." And just her words alone made you go, "Fine, Sister Jane, I'm fine. All right. Now I can get back to, what I
right,
was supposed to be doing." But
right.
I think just the way they would recognize that the work we were doing was challenging, and being there to support us meant a whole lot. So,
And so we've talked over the course of the podcast with various business owners who bring their faith in God
mhm.
and Jesus to work with them every day. I think a Catholic hospital is the ultimate example
Yeah,
of that, don't you?
yeah, yeah, indeed.
That literally the love of neighbor that
Yeah,
we experience through our love of God through Jesus is not only how we experience patient care,
yeah,
but how the employees of the hospital work together.
right.
Do you agree with that?
I do. I do. I think it's that trickle down effect. Like, we felt it from them, so we passed it along. One of the things that I was very proud of, and when I was at St. Joseph's, was we had an emergency fund, and the emergency fund could be used to help employees. And what reported up to me at St. Joseph's was the registration clerks, right? The business office. And a lot of people who are in these entry level jobs are having, living paycheck to paycheck. And they would come to me. I had a pretty open door policy, and they would come to me, and I would approve to pay their light bill or to pay their water bill. And it was Sister Jane again. She came to me. She said, I just wanted to talk to you because you approve more emergency loans than anybody in the hospital. I said, "Oh my gosh, am I in trouble? Like, I'm
Yeah.
so sorry." She goes, "No, I just want to know what you're doing because that's what it's there for." And, I told her that I just have an open conversation with my employees that all of us have challenges in life. And if we don't know about them, we can't help you. When you come to work, we expect you to do work. But if there's something we can help you with, you need to let us know. If you can't be in front of a patient today because you've got something going on in your life, just tell me, and I'll make sure I'll put you somewhere where you can't be with a patient and trigger you. If you have something, let me know. And so we did. We signed a lot of emergency loans for our own employees to pay water bills and light bills. And I appreciated her wanting to go, "Why? What are you doing that makes people so comfortable
Right.
approaching you?"
Right.
And I'm like, "Well, I essentially just said, when you come to work, I expect you to do your job. If there's something that you are struggling with, if you don't tell me, I can't help you. And I'm still expecting to do your job. So let's have that dialogue so that I can put you in a place or try to figure out how I can alleviate that burden so that you can do what you need to do for the hospital and the patients."
I love that because if somebody's not able to do their job, that affects the whole mission of the rest of
Oh,
the
yeah.
hospital. Valerie, I think the leadership that you showed in that situation and talking with your employees and recognizing that every person has some kind of need
Right.
was not only a terrific example of leadership, but really applies in any business, not just a
Mm-hmm.
Catholic hospital.
Agreed.
You agree with that?
I do.
So, for those of our listeners today who are listening and own their own business
Yeah.
or are executives in for profit, maybe even publicly traded companies, how did the emergency fund work?
Yeah, it was a pot of money that the Sisters of Mercy had through their foundation.
Mm.
And essentially, within a certain dollar amount, I had the authority to authorize the hospital to pay whatever it was, right? It was they trusted me as an executive to make that decision. So I just they would come in, they'd present what their struggle was. I'd be like, "Well, I can pay that $60 light bill. If I can pay that $60 light bill, are you going to be able to focus on work
Exactly.
today? And they're like, absolutely. I'm like, consider it done, right? That's an easy $60,
Right. Right.
to do. So it was just a pot of money that was allocated. And apparently they were watching it, right? Because that's why she
Great.
knocked on the door. But it was just, we were educated about it. And we were able to just use our professional judgment on when we could use it.
I
And,
love it.
and obviously I didn't abuse it, right?
Right.
Made sure that it was for the right purpose. I mean, it was tended to be water bills, electric bills, things like that,
Sure.
that I know they were struggling with.
And a great recognition that the poor and needy are there as your patient base, but the poor and needy are also there to take care of that patient base.
Exactly.
Right?
Exactly.
Let me ask you this. So we talked a little bit about this a couple of weeks ago. Some people out in the world are poor and needy. Some people out in the world are poor and needy and tend to take advantage of systems that are put in place to help the poor and needy.
Right.
Did you ever see that in the operation of the emergency fund with your staff?
Not with the emergency fund with the staff. I did see it though with patients.
How so?
So St. Joseph's was known as a Catholic hospital, and there would be people who came who knew that if they presented without insurance, that most likely the bill would get written off. And so when I got there, I really wanted to tighten up the revenue cycle, right? We, no margin, no mission, right? No margin, no mission.
Hold on to that just one second. For those of us who are listening and not familiar with healthcare, what does it mean to say no margin, no mission?
If we don't make a profit, we cannot reinvest into the business of healthcare. I cannot hire more nurses. I cannot get that new MRI. And so me helping to make sure that I'm collecting every dollar due, make sure that we can continue the mission of the hospital. So no margin, no mission. And I got in there, and there was definitely some loose processes. And one of them was around self-pay and charity care. So as I was trying to tighten up the policies, make sure that our charity care policy was good, I implemented a self-pay contractual adjustment equal to our worst paying managed care contract. We discovered that there were people who saw St. Joseph's as this place they could get free care when they are also living in Country Club of the South.
Oh,
and so everything had to go to I cannot remember the name of the committee, but it was the sisters. And so as I was working on tightening up some of these self-pay policies, I wanted to make sure that I was closing that loophole for the people who did have the means to pay, but making sure that it was still there for the people who didn't have the means to pay. And as I was walking them through it, one of the nuns, and it was just one of the funniest things, I said, this is what I'm trying to stop. And I presented this case of a gentleman who had his own business. This was before Obamacare, so he didn't have to have insurance. And he was coming and get his care for free at St. Joseph's, yet living in Country Club of the South. I said, this is the person who I'm trying to corral.
Yeah.
And one of the nuns looked at me. She goes, this shit needs to stop. And she goes, and I go, no, you're right. This shit needs to stop. So you can edit that out. But I was like, I want you to know that there are people who are going to take advantage of your generosity. And I want to protect that money for the people who do need that money, right? And I got them to help close that loophole down. So
it's so funny you say that. So 800 years ago, Thomas Aquinas wrote a lot about charity and a lot about love of neighbor, and in fact described charity as the highest virtue because it's the foundation of all other virtues.
Right.
But he did warn the folks around him who were reading the Summa Theologica and the folks that he was, a pastor to say, you've got to watch out for people that take advantage of you and have some discernment in the way that you provide, from your generosity.
Yep.
I'm proud of you and the sister for calling this guy out.
Yes. I said, I promise you, I am not trying to shut down the working poor. Those people are my people that I'm trying to help. I was trying to, shut down the guy who's driving the Mercedes, lives in the Country Club of the South, and just decided to use us as his free care system.
Yeah. So let's talk about, though, on the opposite end of the spectrum, because it's a Catholic hospital, because there's needy both in the patient base and the employment base. What kind of examples of support did you see at St. Joseph's, or really for any hospitals that you've worked with? Because the Christian capitalist theme is to share the blessings that God has given us with the world in the name of Jesus and give generously after working hard. Did you ever encounter folks who made an extraordinary effort, whether it's like the widow's mite and just a little bit,
Yeah.
but all they had, or someone who did more because they were wealthy and had the means to do so?
I think I saw it every day in the staff. I think the people who do what we do every day, especially the ones who are sitting at the front desk with the patients, they're giving what they can to the patients, right? I had one registrar. She said to me, she goes, if I can just try to get them to smile by the time I'm done, I know that I've done something good.
Wow.
Because I know they're having a stressful experience. I know they don't want to be here. And if I could just get them to curl those lips up a little, then I feel good about it. And everybody who worked for me really was there for the patient. I can't cite one person who didn't want to do what we do. We just aren't scientists, right? We're not the clinical caregivers, but we want to have some sort of positive impact in these patients' lives. And everybody saw it every single day. So I don't think I ever saw any grand gesture, but I saw a lot of little things in terms of, making sure that the patient smiled by the time of the end of the registration, calming the nerves of, the family who's all stressed out, helping somebody who's lost in the hallway. One of the things that was expected of us is that if you saw somebody who looked like they didn't know where they were, you didn't just stop, you didn't just ask, you actually escorted them there.
Oh, wow.
That was expected of us. And that was one of the only reasons you could be late to a meeting, was that you were escorting a patient or a family member to their location.
Wow.
Yeah. I drew
That's
the line,
great.
though, for people who don't know St. Joseph's. It's Pill Hill. You got Choa, Northside, and St. Joseph's all together. I did encounter somebody who happened to be in the tunnels and they were trying to get to Northside. I said, well, that's where I'm going to draw the line. I'm not going to walk you all the way to
To
Northside.
another
I will
hospital,
walk
right.
you anywhere on this side of the campus. I said, but you guys have to go across the street over to Northside. And
That's
hopefully
funny.
there's a me over there waiting for you to get escorted around.
That's great. Well, Valerie, as we draw our conversation to a close, we're going to put links, whatever you send us, we're going to put links into the
Okay.
show notes here. How do you think people who aren't involved in healthcare can assist patients in need? I know that's a big picture question. It may vary depending on the hospitals that are in particular communities.
Yeah.
But what's a good way for us to start?
First things first, here in Georgia, I encourage anybody and everybody to look into the Georgia Heart Program. One of the things that our legislature has done is allowed us to decide where we want to spend our tax dollars, and you can allocate your money to a rural hospital in need. So I do participate in the Georgia Heart Program every year. You don't have to pick a rural hospital; they'll pick it for you. But if you know there's a struggling hospital out there, it is a 1-for-1 tax benefit. You will get it back. You're just essentially telling the legislature, I want to use my money to help Union General Hospital or Upson Regional, and then you'll get
Wow.
1-for-1. So look at the Georgia Heart Program. And then just also reach out to the hospitals and see how you can help and volunteer, because they are definitely in need. We are still reeling from the post-COVID world, and hospitals are struggling. So anything that we can do to reach out to them. They have different funds that you can participate in, different fundraisers. So I do participate, with Grady's Foundation, because, Atlanta can't live without Grady. There's my plug for them.
That's what you see on the billboards.
And I do. I'm like, if I have to give money, I'm like, I hope I never have to be a patient at Grady, but I want you there. I want you to stay open, and I want you to be able to take care of me if you do. So I would just encourage people, Georgia Heart Program, or reach out to your local hospital and just see if there's different ways that you can help support their foundations.
That's great.
Yeah.
So, Valerie, as we draw our discussion to a close, I have to ask you our signature question. What does it mean to you to be a Christian capitalist?
I think for me, like I said, God didn't give me good science genes. He gave me math genes. Yet my experience, it was a medical experience that I had when I was 16 years old, made me go, I don't want another family to go through what we go through. And so for me to be a Christian capitalist, I'm taking the talents God gave me, math and finance. I'm trying to help hospitals and health systems be as efficient and effective as possible, make sure that they can remain open. I'm super passionate about rural hospitals, because if we lose a rural hospital, it's not only the death of a community because they're the largest employer, but it's the literal death of somebody who couldn't make it there. So I always want to say if I want to generate $1 so that they can put it back into the system and hire more nurses or get the equipment they need. So for me, it's really just taking the talents that I have been given and applying them in a positive way so that I can help hospitals and health systems stay viable.
I love it.
All right.
Valerie, thank you so much for
Oh,
joining
no,
us
thank you.
today.
This was awesome.
I'm so glad to visit with you, and keep up the good work
Thank
on
you.
behalf of hospitals everywhere.
Thank you. I appreciate
And
it.
thank you all for joining us today on the Christian Capitalist Podcast, where the more we make, the more we give.